And I have no intention of doing that at this particular point. They have a right to ask questions if they desire to do so. We don't have to answer if it's inappropriate under the rules of evidence. I would give it some consideration. And my thoughts would be to ask them to have patience with the process. We are not television. And in fact, I would tell them that when we come in.
That sounds appropriate. Thanks.
Acceptable to the state.
Yes, Your Honor.
Acceptable to the
Yes,
state.
Your Honor.
Go ahead, bring it through. Just one cautionary thing, ladies and gentlemen. We thank you for the notes that I've been receiving. However, I'm going to caution you to please have patience. We have an adversarial system, and we're not like television, and things tend to unfold over several witnesses and over just one. Anything further to state?
No, Your Honor.
Anything further?
No, Your Honor.
Further evidence, state?
Your Honor, the state would call Dr. Robert Falgi.
Do you solemnly swear the testimony of this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you, sir. Please be seated.
Would you state your full name for the court, please?
Robert Newton Falgi.
And Dr. Falgi, how are you employed?
I'm a family physician, board certified. I'm part of the Veterans Administration and serve the public in their Raleigh office.
And where did you get your medical training?
Indiana University School of Medicine,
And-
1984.
And after you had your basic medical training, did you have any additional medical training for any kind of specialties after that?
Yes, family practice from 1984 to 1987 in Fort Wayne, Indiana.
And have you is family medicine your specialty within the field of medicine?
Correct.
And are you licensed in North Carolina?
Yes, I am,
Are you
since 2000.
I'm sorry.
Since year 2000.
And are you licensed to practice medicine in any other states?
Formerly in Indiana, but let that lapse once we moved down here, 2005 perhaps. I'm not positive exactly when.
So you've not been practicing medicine in any state other than North Carolina since approximately 2005?
Since 2000.
2000?
Yes.
Now, are you required as a physician to have any kind of continuing medical education even after being licensed?
Yes, and the standards for family practice are higher than for the North Carolina Medical Board.
You could slow down. I'm having a
I'm
hard
sorry.
time.
The standards for the American Board of Family Visit Practice is higher than the North Carolina Medical Board. So I'm licensed by the state North Carolina Medical Board as well as certification through American Board of Family Practice.
And the American Board of Family Practice requires you to have more continuing medical education than the state of North Carolina does.
Yes.
And have you always been in compliance with those higher requirements rather than just the state requirements?
Yes.
And do you belong to any kind of professional or have any kind of professional affiliations?
Yes, the American Academy of Family Physicians, that's the umbrella group for family practitioners, and also Christian Medical Dental Association.
And do you have any special or additional accreditations within the field of medicine?
No, I do not.
Now, you said that you're working for the VA, is that correct?
Yes.
Is that your full-time job, working for the
Correct,
VA?
yes.
And as a family physician at the VA, at Veterans Affairs, what kinds of people do you see?
Very sad situations. I see a large number of people, approximately my age, I'm 57, who have serious medical problems, both physically and mentally. Many social issues, and many people with intertwined complex problems that require multiple medicines and multiple specialists and multiple interventions.
And the people that you see, are they all veterans, or is it also veterans' family members?
Good question. It's all veterans.
Now, what are your actual duties as a staff physician at the VA? On a day-to-day basis, what is it that you do?
Most of my time is spent seeing people in the office. I, unfortunately, like all doctors, have paperwork to do too, but the vast majority is taking care of people, direct patient care.
Now, since October of 2007, were you Jose Perez's primary treating physician?
Yes, I was.
He was seeing a number of other specialists as well, was he not?
Mm-hmm. Yes, that's correct.
And he had been treated at the VA before you even began working with the VA, is that correct?
Yes, although pretty early on I was taking care of him, yes.
And all of the various specialists and doctors that he had been seeing, in addition to yourself, those people generated records that were made part of his record of his general state of health, is that correct?
That is correct.
And as part of your job as a treating physician, would you have to make yourself familiar with all of his past medical problems and conditions in order to properly treat him in the present?
Absolutely.
And did you do that?
Yes, reviewed records he brought in or records that were sent to me. I don't remember specifics of his case, or records that were scanned in the computer from different hospital stays, plus the information he'd share with me, and yes.
So when Jose Perez first came to you as a patient in 2007, what were his then main health problems that you and he were having to deal with?
Quite a few. He's one of the most ill people I've ever seen that's been able to function for a period number of years, as opposed to dying quite quickly. Do you want me to go over those, tell in some detail? Would that be
I would,
helpful?
yes, please.
Okay. He's been diabetic for a number of years. I believe it's the 1990s, if memory serves me right. He first became diagnosed with diabetes. Unfortunately, suffered complications of diabetes. Among the most annoying to him was nerve pain and nerve tingling in his feet. And his was not a mild case, all the way up to his knees. And multiple documentation by me and other medical providers about this. That affects a person's balance. That he also had weakness in his legs from separate problems, pinched nerve in his back. Lumbar radiculopathy is our fancy word for it, but pinched nerve in the back is the point across. I'm sorry.
It would help the core reporter and me.
I'm sorry, Your Honor. Yes, okay.
Start back with, he had some complications from diabetes.
Yes, complications of diabetes. I mentioned about the nerve pain and tingling in his feet, and his is a more severe case. Up to his knees, he'd have tingling. I did mention you probably had diabetic nerve damage to his stomach at one of his scopes, and I wrote down here what year it was. 2008, I think it was. I'm not documenting what year it was. Point is, he had his stomach had some food inside it, so I don't think his stomach was working very well either, pushing food through. He also had pinched nerve in his back, which caused him to have leg pain and leg weakness. He had a lumbar fusion at one point to help this. It was better, but not greatly improved.
What's a lumbar fusion?
Basically, the bones of the back, think of like bamboo with the section between the parts of bamboo cut so a person can move. And his was fused so that those parts were held together because his back was so damaged. He had the surgery to do that.
So that would limit his bendability?
Absolutely, limit his motion to some degree, yes, yes.
What other issues did he have?
He had Wilson's disease, which is a problem with copper in the body. Too much copper, the body can't get rid of it. These trace chemicals like copper are important for our health, but if you have too much of any good thing, it can cause troubles. His deposited so much inside his liver that he eventually had to have a liver transplant in 1997. He saw the stomach doctors thereafter for follow-up of his liver troubles. He also had multiple biopsies done of his liver. Even in 2003, it showed some scarring. The worry is that that liver, that was a new liver to him, would fail prematurely at some point. He has multiple medicines to avoid rejection of the liver, and those medicines are harsh on the body.
What kinds of problems do the medications cause?
They can cause troubles with increasing risk of other infections. So you're trying to help one thing but worsen something else. That's a bad trade-off. He was seen by the GI people periodically for follow-up for that too. I think that
GI is?
I'm sorry, gastroenterology, stomach specialist, pardon me. Okay. Like any field, we use a lot of abbreviations. On a day-by-day basis, among the things that affect him the most as far as functioning was his right hand atrophy. Fancy way of saying the muscles wasting away. If you've ever seen somebody starving, muscles start wasting. And his hand was very visible. You'd see him on the street, you'd notice this. It was so obvious.
Did he carry it in a certain way because of the atrophy?
A long time since I've seen him, but a little bit unusual as far as the way he carried it. But the more important thing is he just couldn't use his hand very well. He saw multiple specialists before the VA and the VA, neurology, neurosurgery, had lab work done by me and other people. And the problem is he had multiple areas where the nerves were damaged, so that made him much harder to treat. Over a relatively short period of time, he eventually had surgery to help pinched nerve in his wrist, carpal tunnel. I'm sure people have heard about that. Take the pressure off that, as well as his elbow. Both of those were done from a period of August of 2011 through February of 2013. He had 4 surgeries in that approximately year and a half period to release the pressure on the nerves. He regained some function, but still had a very significantly weak right arm and not a whole lot of function. In early January 2013, because his hand wasn't functioning very well, he was seen by the occupational therapist and had special spoons and special forks because he couldn't hold very easily a normal fork or spoon. His hand was so weak.
What kind of special fork and spoon?
When they're built up, they're much thicker.
The handles of them?
Yes, yes. I think a small child who has a large, thicker pencil when they're learning how to write, same principle, much bigger diameter. And
did those special eating implements have a particular name?
Build-up utensils.
Okay.
I call them that. That's probably not technically right.
Okay.
Occupational therapists would probably correct me on that.
What other issues did he have?
He had significant difficulties getting around. When I first met him, I remember him very vividly because he was using these walking sticks, which is a little bit different than a crutch or a cane. You just hold it with one hand. These had some braces on his arms. He used them both hands to get around. Over time, he got somewhat improved. My last note on him in May 2nd of 2013, about a month and a half before his demise. What can I read from this directly? Is that a good idea?
Is that your notes that you're reading from the
Yes,
visit?
yes.
Sure.
Because of all his difficulty getting around, he's in the midst of a HISA evaluation. It's HISA. Veterans Administration is a wonderful program to help people to modify their home. The VA will pay in part at least for some home modifications. The plan was to have a wheelchair lift for outside access to his home, also 2 ramps, doorknobs changed, bathroom modified, etc. And there was a long list of things to make it easier for him to be able to stay in his own home. I made a comment, using crutches less often than before, now half of the time. After walking a few minutes, has worse leg numbness, and both thighs are cramping. So even after all these massive interventions, he was better but not great. He could walk, he said, maybe 10 minutes, a half mile or so, but you need to use an inhaler, albuterol inhaler, to open up his airways to be able to get around to that point.
And why did he need to use an inhaler? What was the problem with breathing?
Other mentions, I think they didn't mention, this gentleman unfortunately suffering from 3 different cancers, including lung cancer. In 1986, he had to have part of his lung removed as well as chemotherapy thereafter. The lung itself would therefore not be normal as far as lung volume, as well as the damage from the chemotherapy. So his lungs were not in the best of shape. That was not his major problem, but it was a significant one. Hard to tell how much of his limitations of walking because of his leg problems, because again, the pinched nerve sort of difficulties, or the breathing, or heart. He also had coronary artery disease too. But the heart and the lungs were second fiddle to his bone and joint troubles, so making it so difficult for him to get around.
Tell me about his coronary artery problems.
He had more troubles back in 2005 and 2006. I have a list of the different interventions here. He had some stents, which is like a spring of a big pin put in the arteries of the heart to keep that artery open. His last catheterization to look at the blood vessels, the last time they actually checked the blood vessels out was 2010, and no more intervention was needed. Again, he had serious heart disease, but it seemed to be relatively stable, and that was not the major issue affecting him day by day.
What kind of effect would the kind of heart disease that he had on his physical abilities, his stamina in doing anything that he would choose to do?
In my judgment, if he had been able to walk more easily, if he had not had all the orthopedic problems, the leg pain, the leg numbness, I think he probably would have had more troubles. He would have said, after walking, say, a mile, I get chest pressure. After doing lifting, I get in troubles. But he was so debilitated other ways, he just wasn't that active. He tried to be as active as he could, and he did go to the gym some. He tried the best he could. But I think his heart disease would have been more apparent if he hadn't been limited in other ways.
Now, aside from the, how many stents did he have put in his heart?
I have it written down here. Bear with me a moment, I'll find out here. On his problem list, I put down some information here and stuff. From what I can see, he had 2005, he had stent in October of that year. No heart attack, but had a stent twice. And then just a month later, apparently he had more troubles. He had a heart attack then and 2 more stents. And as far as I can, that looks like the only stents he had. Again, 2005 was a terrible year from a heart point of view.
And what is a stent?
Think of like a big spring of a big pin, and they can fold this up so they put it inside the artery of the heart and open it up so it keeps the wall open. Think of a scaffolding, basically. That's the way to think about a stent.
And you said that he suffered a heart attack in 2005?
Yes, according to my notes, in November of 15th of 2005.
And can you characterize to what extent there was damage to his heart muscle because of that heart attack?
I can, again, this is before I met him, okay, but I can say in 2010, September 2010, just shy of 5 years later, I had a sound wave test, echocardiogram, and did pretty well. It was not functioning normally, but doing pretty well. So again, I don't think that's the major issue facing him compared to everything else.
What, because of the liver transplant that he had, you said that he was taking some drugs that were pretty harsh on the system. Was he also taking drugs because of the diabetes that he had?
Yes, this gentleman was on insulin, and he had significant troubles with the sugars going up or down. If he delayed eating, his sugars go down too low. If he's more active, for example, he's trying to go to the gym to be able to get himself in better condition, his sugars will go down low too. And
What happens when your sugar gets too low?
the brain gets affected, the person becomes dizzy, lightheaded, headachy. If it goes down low enough, a person will lose consciousness, but just not acting right. You may look at a person that's not acting right. Once a person eats something, typically the symptoms go away, but it's pretty scary when it happens. He's on insulin twice a day, according to my notes here, because of that. In the morning, a significant dose, and evening, a lower dose.
And why would he be prescribed a larger dose in the morning and a lower one at night?
The thinking is that you eat more during the daytime, assuming a person eats decent meals, breakfast for lunch, and you certainly want to avoid low sugars overnight. That's a pretty usual standard, twice the amount in the morning as you have at night. That's not a rule, but kind of a guideline.
And you talked about that Mr. Perez had problems with both of his legs, that he had tingling sensations or loss of sensation to some extent from the knees down to his feet.
Correct.
And that he had had surgeries on both of his arms for carpal tunnel,
Yes.
both of his wrists, and that he'd also had a problem with one of his elbows. What was that?
Well, actually, both elbows. He
Okay.
had ulnar, or at least the crazy bone nerve right here in the elbow. If you tap it hard enough, your fingers tingle, and that nerve can get entrapped. And he had it both sides.
And so he had either tingling or loss of sensation on both arms from the elbow down to his fingertips.
In addition, strength loss. Yes, he had that, plus also strength loss.
So he had multiple problems with his arms and
Yes.
his legs.
The right was worse than the left for his arm, both of them significant.
And as part of the issue that he had with the loss of sensation or the tingling and other problems, the atrophy of the muscles, particularly in his right hand, were there certain specific things that would have been difficult for him to do? You've mentioned using regular utensils to eat. What other kinds of things would have been difficult for him?
Something as simple as opening a doorknob. They were planning to change the doorknobs at his house, which, best of my knowledge, is not done before his demise. Just lifting up ordinary objects would be a challenge.
From a regular, presumably round doorknob, what would be the preferred kind of doorknob for somebody with his kind of loss of feeling in his hands?
Good question. A latch. Much easier to grip than a round doorknob.
And how old was Mr. Perez when he came to you?
Let's see, he was 64 when he passed away. That was 6 years later, so it must have been 57 or
around
57, 58, yes.
Until his death.
Yes.
And the last time you saw him, you mentioned, was in May?
Correct.
Of
May 2nd,
2013?
2013, yes.
What was his height and weight at that time?
Height, weight, and on the page here. Thanks to my good nurses. Okay, height was 69 inches, or 5'9", weight 196 pounds.
Some of the disabilities that Mr. Perez had were service-related injuries, were they not?
That's my understanding, yes.
And that he was rated as 100% disabled by the VA.
I would suggest looking at 100% service-connected, not necessarily disabled in the sense a person can't do things.
Right.
But the
So-
VA is saying 100% acknowledgement that this person has these medical things are impairing that person to degree to be 100% rated.
So he had all that problems. That doesn't mean he was bedridden. He could get around.
Yes,
He
correct.
could do things,
Do things to some degree, yes.
but they weren't done with ease.
That's a very good way to look at it. We're not done with the ease, not done with the fluid motion if you watch somebody who just ordinarily walks. No, correct.
So it would, is it fair to say that if a stranger saw him walking into your office, that they would know that there was some issue with his?
That's fair to say. A person would say, this person's walking pretty slowly. If they're paying attention to the right hand, they may notice it's not clawed hand. That's too much of exaggeration, but just not moving normally or freely.
And you've told us that there were a number of remedial measures that were taken to try to help him out with all of the issues, that he had the walking sticks, as you describe them, with the brace that goes around the forearm, that you had had him assessed to have all these changes done to his house, which unfortunately weren't done before he died.
Yes.
Were there other measures taken? You said numerous surgeries.
Yes, I had the neurology people as well as neurosurgery take a look at him. The challenge was figuring how much of what he had going on was because of the diabetes. This ravages nerves in the body, all over the body. I mentioned the stomach, I mentioned his feet, but it's all over. It's not just one place. Versus a nerve being pinched, like pinching a garden hose. In the case of him, both wrists and both elbows. And that's why I got the neurology people and neurosurgery people involved, as well as doing lab work. And he was improving to some degree.
Was his balance still affected because of the issues with his legs and feet?
I looked at my notes. I don't remember writing about him having falls, to the best of my knowledge. But I would say it's fair to say that the only way he could get around would be walking slowly. And I made observations about that in my notes, that you would not want to ask him to go on a boat ride or anything like that, where you need to have better balance.
You obviously had some concerns about that if you were working with the people that would alter his home to make it safer for
Yes,
him.
that's correct.
A lift to get upstairs, or a ramp instead of stairs.
Yes.
Would that be because of his balance?
Correct. Yes, a ramp to get in and out of the house. I don't believe it was a lift for the stairway considered at that point.
Because of the pinched nerve in his back and the fusion of part of his spine, would it be fair to say that he suffered chronic pain?
Yes, although he dealt with it pretty well. Pain was not a major driver. It was more the difficulty getting around. Yes, he had some pain too, but that was, fortunately for him, not a major problem.
Did he have prescriptions for some painkillers?
That was a challenge too, because of all the medical problems he had. Be very careful about drug interactions, and, drug side effects and stuff. And look at my last note. I don't see any specific pain medicines there. That was not a major player in his situation.
Did Mr. Perez also have osteoarthritis?
Yes, he had some documentation. I have it written down. Hands and also feet. The garden variety osteoarthritis, the wear and tear joint disease that so many older people get.
And what effect does that have on your ability to walk or to use your hands in regular, everyday sorts of
It can
things?
cause some aching and discomfort, make it harder to do things.
Did he also have hypertension?
Yes, if memory serves me correctly. Yes.
And was he being treated for that?
Yes.
Are there side effects from some of the drugs that you take for hypertension?
Unfortunately, all medicines have side effects. He seemed to tolerate them well, with the possible exception of two. One is the insulin. If you get too much insulin, person not eating as well or being more active, sugars can go down. It's a tricky drug to manage. He had a fair number of low sugars. He also apparently took extra dose of one of the medicines for chronic pain, which is gabapentin. I misspoke a moment. He wasn't gabapentin for the nerve pain. And that's a drug that can make people drowsy. He did not present that way.
And when Mr. Perez had the surgery on both of his wrists or hands for the carpal tunnel syndrome, Was there testing done over time to see if his function would improve?
Yes, EMGs were done. That's not a very nice test where you have needles put in your forearms or legs, whatever body part is being checked to see how well the nerves function. And had one in February of 2000, my right date's right, 2012, and also one late 2012, and in between, the right hand was some better because he had the carpal tunnel release. But again, I want to stress it was not like it's fully improved, it was just some better.
There was continued wasting of his hands, was there not?
It seemed like it was pretty stable, which is another clue, at least it wasn't getting worse, but better is kind of a relative term, and he did not really improve that much as far as function of his hands, unfortunately.
At some point, you said earlier that you weren't aware of Mr. Perez having a problem with his balance such that he suffered falls. In 2010, he was treated for a broken ankle, wasn't he? Because
Yes.
of the fall?
He was treated for a broken ankle, and I don't remember the cause of that injury, though. It should be in my notes here. I read my note from January 6, 2011, talk about having a distal fib, that's the very lowest part of the lower leg on the outside of the ankle, fractured December 28th, and sent it to ER and then my orthopedic surgeon. What I don't have documented is whether it had a fall or tripped over something, hit something or whatever. I don't really document that.
He was prescribed a walker at that point, wasn't he?
Correct. And he gradually recovered.
Were you aware of any hospital admissions? I think you had mentioned them earlier, that in 2013 he had hospital admissions for hypoglycemia.
Yes.
What's hypoglycemia?
Word for low sugars. And I'm reading from my note from February 12th, admitted for altered mental status, AMS, and very significant hypoglycemia, very low sugars. He was inpatient from February 3rd to February 5th at an outside hospital, then transferred to the Durham VA Medical Center. He says he'd been eating normally. He thinks he doesn't, there's some question when he took an extra dose of insulin. He didn't think he did, but there's some evidence that he may have done so and inadvertently take a double dose of the insulin, which caused him some troubles.
And when he was originally brought to the hospital, do you have in your notes whether he was unconscious or not?
I do not. It says altered mental status. I don't. And that was, again, an outside hospital.
Do you recall Mr. Perez talking to you about any issues that he was having with his girlfriend at the time, this defendant, when you, early on when you started treating him, 2008, 2009?
I do not. There's comments about him having a girlfriend and eventually apparently some consideration moving out of state and then getting married and such.
At some point, did you make a referral for him to see a psychologist at the VA?
I know he did, but I don't remember if that was from me or somebody else, quite frankly. He'd be a person with so many medical problems I could spend an hour or more literally each visit and still not get through all the medical problems. I don't remember, to be honest.
Did you talk to him about his being able to cope with all of his medical problems that you recall?
Yes, and he did relatively well. I'd have to encourage him to bring in information I wanted to see, like his sugar record and that sort of thing. He often would forget to bring those things in. But he seemed like, considering all the things he had going on, relatively upbeat.
And when you, how many times do you think it was that you saw him over the period of time from when you first started seeing him in 2007 and when he was killed in 2013?
A total of 22 times.
And in the 22 times that you saw him, did he ever present to you in a way that made you question about whether he had taken some kind of impairing substance, either alcohol or drugs?
No, did not.
Given all of the information that you have about Mr. Perez's physical abilities, do you have an opinion based on that and your medical knowledge as to the state of his motor coordination and strength and his ability to hold, aim, and fire a handgun?
Objection, Your Honor. He doesn't know anything about this, and there was no testing that would go into that. He doesn't even know what kind of gun, if he fired a handgun, anything like that, so.
You can answer the question.
Judging by how impaired his arms were, not just the right one had the visible atrophy, the visible wasting away, but the other arm was quite weak too. I have documentation about how weak it was. I think it'd be a real challenge to do that. I would not say impossible, but I think it'd be a real challenge.
And given what you know about his health issues, his motor coordination and his strength, what, in your medical opinion, would have been the likelihood of him being able to hold on to a thin-handled knife and use it either to attack someone or to protect himself?
That'd be even more difficult. A gun can be held with two hands. It's a much bigger object. As he said before, in January 2013, he's been seen by occupational therapy to have the build-up handles because it was so hard for him to hold the ordinary fork, knife, spoon. So I would believe a regular knife would be even more difficult.
And if Mr. Perez had gotten into a situation where he was in danger, would he have had the ability, the physical strength and stamina to have run to get away from that situation?
No, absolutely not. Even walking at best was slowly. And my last note says in May of 2013, he was still using crutches half the time. Absolutely not.
And would Mr. Perez have had the physical strength and stamina to engage in a prolonged struggle with someone who was near his own height and weight?
I do not believe so, no.
Do you recall or have a list with you of all of the different medications that Mr. Perez was taking at the time?
Unfortunately. My May 2nd note, the last time I saw him, I had the list of his medicines, correct.
And what medicines was he taking back in May of 2013 when you last saw him?
Okay. Albuterol, the inhaler for opening up airways, that's as needed. I'm sorry. Albuterol. You want me to spell that for you?
No.
Okay. Albuterol inhaler for his as-needed airway troubles.
Is that the kind of spray that somebody would have to take
Yes.
if they had asthma or chronic
Correct.
bronchitis or something
Correct.
like
Yes, as needed. Aspirin, 81 milligrams daily. The gabapentin, the medicine for nerve pain, that's 3 times a day. Insulin N, twice daily. That's topical. Loratadine or Claritin for allergies as needed. Metoprolol, twice daily for his blood pressure. Asthmanex, at nighttime for his breathing also, the other kind of inhaler. Multiple vitamins of some sort. Celcept, that begins with a C, that's for his void rejection for his liver. Omeprazole, stomach acid blocker. And that's, Miralax, yes, Miralax is needed for constipation. Simvastatin for cholesterol. Prograf, another medicine to avoid rejection for the liver. It's 2 different doses, excuse me, that's the last one.
Had he already also been prescribed hydrocodone?
At some point, yes. I believe that was after the surgeries and such. I honestly cannot recall if I prescribed it off and on for him or not. It was listed on February 12th note as again closer to the times of his 4 surgeries, but not on my note from May of 2013.
Now, you mentioned earlier that Mr. Perez was insulin dependent, that he had to take insulin twice, once in the morning and once in the evening before he went to bed. If he were stopped from taking his insulin, what effect would that have had on him?
Over time, his sugars would go up pretty quickly. Minor correction, insulin dependent is not really the best way to describe his situation. It's about a meaning a person will die literally within days if they stop the insulin. The adults who develop diabetes do not tend to do that. The children who have diabetes tend to get very, very sick very quickly, even missing a dose or two. But over time, he would get sicker, yes. If that's, and sugars would go in the wrong direction, he'd likely have more complications of diabetes much faster.
Sir, if you would slow down a little bit.
I'm sorry.
I'm getting a note from the jury.
No.
You need to slow down so they can.
I apologize.
Let's go back a little.
Okay. They need to be able to hear you and understand you.
Okay, I'm
You
sorry.
have a lot of information, and if you're talking too fast, not only is it hard for the court reporter, but they can't hear either.
Mm-hmm.
Ladies and gentlemen, that's one of those times. Don't be quiet. Let us know.
Please do. I may not realize it. I apologize.
I understand you're nervous being on the stand, but you need to slow down, okay?
Okay.
So you don't think the right terminology for the diabetes that Mr. Perez had was insulin dependent?
Correct. I don't want to sound super particular, but that's not really correct.
Okay. And what would you use to describe it?
Type 2 diabetic, adult onset diabetes. And some people progress to the point of needing to have insulin.
Too fast?
Some people progress to the point of needing to have insulin. He'd been diabetic for a number of years and had insulin for a number of years. I have that written down here. Where am I writing that? Yes, diabetes was diagnosed in 1996. His feet were numb starting a year later. So pretty quickly he had a complication of the diabetes, unfortunately. Been insulin for a number of years. Again, if you were off of that for whatever reason, you get sick quite quickly.
And what kinds, when you say he would get sick if he wasn't taking his insulin, what kind of sick are you talking about? What things would happen to him?
As the sugars go up, he'd probably have more and more, even worse numbness, not only his feet, but also his hands. He might have more troubles with his stomach emptying his food out. There was some evidence in 2008 on a scope that he had troubles with that already, although he wasn't complaining of symptoms of nausea or vomiting or that sort of thing because of it. He also would most likely develop a lot of sugar inside the bloodstream, has to go somewhere. The kidneys dump out the extra urine, so a person would pee a lot more, and that would be very, very annoying. And may just start feeling less mentally clear, maybe dizzy, blurred vision, just overall sicker.
And at some point, if a person was not taking their insulin, who had type 2 diabetes, of the severity that Mr. Perez did, it would kill him, wouldn't it?
Most likely, yes. Heart disease is much more likely. People are diabetic, and he already had known heart disease. So if he stopped taking good control of his sugars, over time you get the point that that would much more likely cause a demise.
And you mentioned earlier that he was taking a medication to prevent his body from rejecting his transplanted liver, correct?
Correct. 2 different medicines, correct.
2 different medicines.
Mm-hmm.
And did he have to take those every day?
Yes.
And did he take them once a day or twice a day? How often?
I believe they're twice or 3 times a day. Yes, both the medicines he's on, Cellcept and Prograf, are twice a day.
And if he were deprived of or stopped taking his anti-rejection medications, what would have happened to him?
Pretty quickly, but I mean days to weeks, his body would start rejecting the liver, and then he would become quite sick quite quickly. So it's stress to people who have transplanted organs not to miss doses. It's very important.
And what does your liver do?
Liver is a manufacturing plant for different chemicals in the body, storage place for different chemicals. helps regulate sugar. Without it, life is impossible for us mammals, and it's very, very important.
And so all of the blood in your body, does it filter through the liver?
Correct.
At some point, was the neuropathy in Mr. Perez's hands so bad that he had to be sent to a podiatrist because he couldn't even clip his own toenails?
In his feet you're talking about? In neuropathy in his feet?
Mm-hmm.
Okay.
No, neuropathy in his hands.
Okay, but that podiatrist deals with feet.
I know. That's what I'm saying. Was the neuropathy in his hands so bad that you sent him to a podiatrist because he couldn't hold the scissors
Yes.
to cut his toenails?
Okay, I misinterpreted your question.
Yeah.
That's what it could be. He saw multiple specialists. I cannot recall if he's seen podiatry or not, but this would be appropriate.
And if Mr. Perez stopped for some reason or was deprived for some reason of all of his medications at one time, what would have been the result?
Quite quickly, sugars would start rising up. Quite quickly, the odds of rejection would go up drastically for his liver. His blood pressure become uncontrolled. Just a real cascade of events that would be incompatible with life over a relatively short period of time. Not necessarily days, not necessarily weeks, but certainly within a few months, if not sooner.
And would there have been almost immediate signs that he was not on his medications, not death, but other signs of his health problems that would be increased in some way? For instance, would he appear not to be fully in control of his body, or would he seem like he was a little fuzzy or not thinking correctly?
It's hard to say for sure, but I would believe it'd be likely pretty quickly he would have more nerve pain, more numbness, more tingling, more difficulty getting around. Perhaps his mental clarity would not be as good.
I have no other questions.
Witness with the defendant.
Thank you, Your Honor. Good morning, Dr. Sagel. How are
Morning.
you?
Fine.
You went over with us some of the medications that Jose was taking on your last visit that you had documented. One of those being gabapentin. Is that how you say it, gabapentin?
Gabapentin, yes.
Can you explain to us what that is for?
Gabapentin is used for nerve pain as opposed to muscle or arm or joint pain. It's a medicine that's an annoying drug to use, quite frankly, from a doctor's point of view, because you have to gradually increase the dose. It's best taken 3 times a day, which, hard to remember. It helps the nerve perception of pain. The nerves to perceive pain less is a better way to put it. And it does a reasonable job helping people.
And Jose was prescribed that
And he'd been
at
on
the
that
time.
for a long time. It's a stable medicine, not a change in doses and such, yes.
And what would happen if someone were to take too much of that medication?
Person could become drowsy. And there's some evidence that one of the times he may have taken extra gabapentin or something and ended up in the emergency room not long before his demise.
Would have that been around April 16th that overdose was suspected?
In hindsight, he told me he likely took an extra dose of gabapentin. I'm not trying to quote him. I'm paraphrasing what I understood him to say. When he went to the emergency room on April 16th, he changed the pill box after that to prevent a similar error.
And you said it could make you become drowsy, so probably not advisable that somebody be driving if they'd taken extra
Correct.
medication of that.
Correct.
On that particular occasion where he admitted he might have taken an extra dose that particular occasion, he was treated in the emergency room for that.
Correct.
Were you aware that he'd fallen the night before at his home?
I don't have that written down here, but I can believe it. I mean, he doesn't have the best ability I still have the documentation of all the different falls, though, or near falls or whatever.
And you said that, you know, if one becomes drowsy, obviously one could become disoriented or confused.
Potentially, but it's not like the psychiatric medicines where a person become less mentally clear, more just sleepy, not unclear thinking or irrational or doing weird things.
Do you recall if Joanna was at the hospital with him at that occasion?
I do not know. I'm office-based, and I'm just getting information from the hospital. I do not know.
You're his primary care physician. You can't be there every time he comes in, but you generally saw him when he would come into the VA for an appointment.
Well, at the VA Raleigh office, he was in there and saw me 22 times, and he saw the way it worked out, nobody else. It's kind of unusual. Oftentimes they spell each other, but he only saw me there at the Raleigh Veterans Office, the outpatient office.
You also mentioned one of the medications that he might have been on post-surgery for one of his surgeries would have been hydrocodone. Maybe in February you said you had a last note of that.
Correct.
Can you explain what hydrocodone is or does for one that's taking it?
Hydrocodone is a narcotic, always mixed with Tylenol or Vicodin. Maybe people may be more familiar with that. And it's a potent, good narcotic for significant pain, for in his case, after surgery.
And what could be the result if someone took too much hydrocodone?
Fairly similar to gabapentin. Person become drowsy. That's always a fear for us doctors. There's so many medicines people are on nowadays, and we try to limit them, but it's not easy.
Would hydromorphine been something that Jose might have been also given at some point to deal with some kind of pain?
It could be. That's another narcotic. I don't know if he ever had that from the VA or elsewhere, but yes, that's one that could be used, correct, for pain, significant pain.
Well, it wouldn't surprise you to know that he had been prescribed that in February 2007 through February 10th of 2013.
Repeat the question, please.
You said you weren't aware that he was on it at the time, but according to his medical records, he had been prescribed it February 7th through February 10th of 2013.
Okay. I can believe
wouldn't
that, yes.
surprise you to know that.
I misunderstood you. I thought 2007 to 2013. That's why I reacted, because I should know about that.
February 7th,
I understand.
2013.
Yes, that would
February
be...
10th. Probably post-surgery or post-procedure again kind of
I would think
situation.
so. Yes, because he did have the right carpal tunnel done in February 2013.
Is that a highly addictive medication, would you say?
Unfortunately, yes. So is hydrocodone or Vicodin. All these narcotics are two-edged swords.
Had you learned over the course of your treating Jose that he was a recovering alcoholic?
Yes.
Did you have any, I guess, hesitancy maybe in prescribing some of these highly addictive medications to him over the course of your treatment?
I'll read from my very first note I met him, October 2007. I quizzed him about alcohol. I said, no alcohol at all. He quit 33 years ago, was heavy, active in AA, helping others. That's what he told me when I first met him. So that would be interpreted that he had no alcohol. He's quit alcohol before he was 30 years old. Had troubles with that, yes, but he quit alcohol before age 30. He was asked in July 16, 2012 about alcohol intake, denied anything for the previous year, consistent with what he's saying there. So yes, I'm rambling, but your question is a very good one. People with prior alcohol abuse, you'd be a little more concerned about using narcotics, and you'd watch them more carefully. However, the evidence shows that he was using it as needed after having surgery as opposed to all the time. So I think it was appropriate use of it.
But clearly, you prescribed the medication, correct?
Not necessarily, because he saw the specialist for the surgery.
Right.
So if you give it a small
Whatever
amount of
medication
it.
you might have prescribed him and another doctor might have prescribed him, you can't control how one uses those medications. You can only
Correct.
suggest the recommended dosage and the
Absolutely.
recommended usage.
Absolutely.
But you're not there essentially to babysit someone to see to make sure they're taking it appropriately.
Correct.
Would have you been aware in your records or any of your experience in treating Mr. Perez that he might have taken oxycodone over the course of his treatment at the VA?
I did not recall. Again, I have all his papers here and such. That could well be, again, after surgery.
Again, it appears that from his medical records that February 7th, 2013 to February 10th, 2013, that was also prescribed post-procedure.
That could be plausible, yes.
Were you ever aware, or did you know he was taking at one point or another lorazepam?
That could have been through the mental health people, perhaps.
Explain to us what that medication.
I want to say that was years before. I don't think that was recently, but I'm not positive about that either. Lorazepam is a cousin of Valium. It makes people drowsy. A person who feels anxious will feel less anxious by using that sort of medicine. But unfortunately, like the narcotics, they're quite addictive. They're a drug that has to be used very carefully.
Over the course of Jose's treatment, is it fair to say that after a procedure, it wouldn't have been unusual for him to be prescribed some of these highly addictive pain medications?
That's a fair assessment. That's a fair comment. I sorry about being hazy about some of the information. He was seen by orthopedic surgeons, neurology, neurosurgery, and some other specialists, so I don't have all the recollection, all the details, to be quite frank about it.
Did Jose ever discuss any marital issues with you over the course of his treatment?
Not really. He mentioned about a girlfriend at one point. I have some notes in my 2008 talking about that. He was married in September, I believe it was, 2009, and he seemed very happy.
Did Jose ever mention to you over the course of his treatment that he thought he might be dying?
No. I think I never asked that question directly, and he never volunteered it. I believe he had insight that with all his medical problems, he was not likely to live a long life. But no, he never made a comment like that.
But to your knowledge, in treating him around 2008, he wasn't dealing with any terminal cancer type issues or anything
Correct.
of that nature? And you said you can't recall or remember if there were ever occasions where Joanna accompanied him to appointments that he might have had at the VA? That Miss Madonna would have accompanied him to any visits? You can't recall, you testified earlier.
Well, I believe I met her before because of the comment. I wrote this down here. Where'd it go? I don't have the exact date, but 2008, at that time, girlfriend came in. So I believe I did, yes. But I don't remember, to be honest.
Were you ever aware in the course of his treatment that Joanna would often call his doctors at the VA? Do you recall ever speaking with her?
Not directly, best my memory, but of course, people call in to their spouses all the time. That's typical, standard way to help somebody else.
Do you recall, or do you might have in your notes that in July 7th, 2009, Joanna called in and left a voicemail stating that Jose looked like he was going to pass out?
Let's see, 2009? I'm sorry.
July 7th, 2009.
Let me take a look here and see my note closest to that. Oops, that's not it. I'm looking here at a visit on July 9th. There's mentions about a low sugar episode I mentioned before. He unfortunately has had significant difficulties with low sugars at times. And there are multiple phone notes. It didn't say specifically her name. Or so. I tell you that, well, his girlfriend called VA and 911. I misspoke. There is a comment about that I wrote. He was telling me this information. Yes. So yes.
And that she called 911. He was ultimately treated for that that glucose level being off.
Correct.
Turning your attention to July 10th, 2011, do you have any note particular to that date?
July
regarding
10th,
treatment?
2011?
June 10th, 2011.
I have a June 22nd visit in reference to a mission overnight on June 10th because of breathing troubles. And at that point, wife called June 17th, our office apparently way interpreted this information there, but Mr. Perez was not ready to go to the emergency room. Next day, he's mowing his yard.
But you do have that note that Joanna did bring him into the emergency department to be treated for that asthma flare-up.
It didn't say that directly. It's talking about him coming home and then getting a little bit worse, but then apparently getting better.
And you mentioned that you had a note that the next day he was out mowing the yard.
This is a week after that admission overnight. I think I misled the way I spoke that. Let me rephrase that. I'll read from my note here, a little more clear. Had COPD or asthma flare, admitted June 10th overnight. Breathing got worse after home, and wife called 617, but vet wouldn't go to ER. Next day was mowing his yard, now feeling better, and then talks about the treatment there at the ER. Okay. So this is a week after. I think I very misleading the way I spoke that.
Thank you, doctor. Turning your attention to January 12th, 2013, do you have any note about any treatment he would have received on January 12th?
January 12th. I believe that's when he had can you give me a little more details? I have a lot of paperwork there.
I believe that the records would indicate that Miss Madonna called in and said that her husband was nauseated, he was vomiting,
Okay.
he'd been sick for several hours, he was having muscle aches.
Mm-hmm.
She indicated he was insulin dependent, he'd had a liver transplant, she was very concerned about his health.
Mm-hmm. I do not have that information. What I do have is on February 12th, the next visit after this, about him being admitted for very low sugars, admitted February 3rd to February 5th. So we went to outside hospital and then went to the Durham, then it was transferred to the Durham VA.
And I think you referenced that February 3rd, 2000 episodes with Miss Shandles where he was in a hypoglycemic state.
Correct.
And on that morning, did you have any particular notes specifically about February 3rd, 2013?
February 3rd, this said he's admitted February 3rd to February 5th, again for the very low sugars.
And I believe you said he started out at another hospital and was later transferred
Correct.
to the VA.
Correct.
Do you have any notes or indication whether Miss Madonna was responsible for taking him?
I do not know.
Obviously, you said that could be a very bad situation for Mr. Perez to not get treatment in a situation like that.
Absolutely, yes. For anybody with low sugars.
Was Mr. Perez always a very compliant patient?
Most of the time, he at times would not remember to bring his sugar records in. I would gently nudge him to bring those in to show me so I'd see more information as opposed to relying on memory. He had at least once he ran out of his anti-rejection medicines. I can't remember when it was, but I wrote down out for 5 days. But in general, yes. In fairness to him, anybody like his situation on multiple medicines, it's hard to keep track of all this stuff. So I don't want to sound too negative. I'd have terrible trouble if I ran medicines 3 times a day.
On that occasion, February 3rd, 2013, do you have any notes indicating that he pulled his IV out, was wanting to go home, was not wanting to be at the hospital despite his bad condition?
No documentation of that in my notes, no. I had to be selective about what I put in here, otherwise I write books every time I see people.
Understandable, doctor.
Yes.
I believe you've also referenced that April 16th episode of the overdose of his nerve medication, the gampatine. That also could have been a very dangerous situation for him if not treated, correct?
Correct. Well, I'm much more concerned about the low sugars. That medicine would work its outside of the body, extra dose, but that not be ideal. If a person's not thinking clearly and could injure themselves.
But obviously not a good situation for him if he didn't
Certainly
get it regulated.
Not. Certainly not. And again, he was seen at the ER.
Do you know if he was ever treated as a result of that for an automobile accident?
Not to the best of my knowledge. There's no indication here, and that's something that I would record as something like that.
Is it possible that the nurse or intake person might have recorded that, but that you wouldn't have written that in your particular medical note?
That would not be good health care if you had a car accident. I did not record it. I do not believe that's the case.
In the course of treating Mr. Perez, you'd often talk about things he could do to improve his health. You encourage him to work out, to exercise.
Correct.
And he reported to you on several occasions that he was going to the gym, he was
Yes.
working out. And often he'd tell you he at least tried to do 1 hour or more of exercise when he went to the gym.
I don't remember a specific time of 1 hour. You could say he could do something over an hour's period by frequent rest stops, but that would be not possible judging by his condition to exercise for an hour. That's misleading.
Did he ever tell you that he would do the treadmill or walk on the treadmill?
That's different things.
Some of the activities that you can do at the gym.
Right. A variety of things is my understanding.
Weightlifting. Mm-hmm. Did he ever tell you he rode his bike to stay in shape or try to get better in shape?
A variety of things. I don't remember specifics.
But he did tell you he was doing some activity to
Yes.
try to improve his condition.
Exactly. That's a very fair statement. Yes.
Do you recall an incident on May 9th, 2013, where he might have been admitted to the VA?
The last time I saw him was May 22nd, and there's minimal information afterwards. No, I do not.
Do you recall anything, maybe this will spur your recollection, about him being admitted because he was out doing some yard work with some kind of hedge trimmers, and he'd cut his right hand
That's
or
right.
his
Excuse me.
finger?
Yes, I do remember that now. He went to the emergency room after, again, doing yard work, cutting his finger, and elected not to stay for treatment.
And obviously, to do yard work and use hedge trimmers, he would have had to use his hands to do that, correct?
Correct. Yes. I do encourage even my people who are quite debilitated to be as active as they reasonably can. That's good. He was trying to do what he could do.
And I believe you testified on direct, Doctor, that, you know, he might have been 100% disabled, but that didn't mean he was 100% able of doing anything.
100% service connected.
Right.
Please don't use the word
Right.
disabled.
And
That's,
there's a difference
yes.
there. So, you know, while his health might have not been good, he was not bedridden, he could get around, he was mobile.
Mobile to a point. When I first met him, he actually talked about having a motorized wheelchair and that sort of thing, and he was using less of those as time went on, but mobile to a point.
And you said, though, in 2013 that those, he seemed to be improving in many of those respects.
Improving to a point. And his comment to me was using crutches now about half the time. So improving, but it's a relative sort of thing,
Sure.
sadly.
But there could have been deterioration on the alternative to that. I understand it's relative, but somebody can deteriorate, somebody can maintain, somebody can
Sure.
improve. So at least for him in his condition, an improvement would have been a good thing.
Absolutely.
And I believe you looked and you said you might not have recalled, but when he came in with the broken ankle, he didn't indicate to you that he'd dropped some equipment while carrying some equipment around? Is that?
I did not record the mechanism of injury, so I do not know.
That could have been the case. You
Again,
just didn't make a note of it.
Right, the orthopedic people were dealing with that, and I had enough to deal with everything else, so I do not know.
Were you aware that Jose was responsible for giving himself his own insulin injections? And again, that's something he would have to use his hands to do to give himself his insulin injections, correct?
Correct.
Thank you. Thank you, Doctor.
I have a few questions, Doctor. Mr. Perez was responsible for giving himself his own insulin injections, correct?
That's my understanding. He was clearly giving himself insulin and clearly filling the medicines on time, and I don't have documentation of all the details there, but...
Okay. It doesn't take a great deal of strength for someone to inject themselves with insulin, does it?
No, very little.
And you don't have to be real steady-handed because you don't have to hit a vein or anything like that, do you?
That's a correct assessment. You can use your hand to support a part of your body to give yourself an injection. So yes.
And it's part of your training and as a doctor to be careful about, as you mentioned earlier, drug interactions, correct?
Mm-hmm.
And it's not just family physicians that learn about that. It's all kinds of specialists as well.
Certainly.
Neurologists and GI people and whatever specialty there might be.
Certainly, yes.
And because of that, when you personally and doctors generally as a profession prescribe narcotics of any kind, you do that very carefully, correct?
Yes.
And when you do it, you don't prescribe unlimited amounts or for unlimited refills, correct?
Certainly not. There's been tight controls, even tighter now than years ago on that, and appropriately so.
And as part of or one of the problems that Mr. Perez might have had concurrent or because of the diabetes that he had and the severity of it, would that have affected his sexual performance as well?
It certainly can.
Would any of the other medications that he was taking have affected that?
Potentially metoprolol is belongs to family drug medicines that can cause childhood erections for men. Not everybody has it, but it can.
I have no other questions.
Just one last thing, Doctor. Over the course of you treating Mr. Perez, that was in the hospital setting, correct?
No.
You only treated him in the hospital. You had no relation to Mr. Perez outside of your treatment. You never...
Outpatient setting. I'm not doing any hospital work at all for the last number of years. But if you're asking, have any relation
I meant in
otherwise,
terms of treatment. Maybe I said that wrong, but you treated Mr. Perez.
as an outpatient setting.
Correct.
Yes.
You never had any opportunity to see how he interacted in his daily life outside
Correct.
of your treatment.
Correct. No other relationship. The men in the way, no.
Thank you. Nothing further, Your Honor.
Any further?
No, Your Honor.
Thanks, sir. Your statement.
Okay.
We've got him being released from this thing.
Not from the state, Your Honor.
No, Your Honor.
Further evidence, state.
Yes, Your Honor, there will be. State your full name for the court, please.
Yes, Dr. Lauren Scott.
And where do you work?
I work at the Office of the Chief Medical Examiner in Raleigh.
And what is your position there?
I'm an Associate Chief Medical Examiner or Forensic Pathologist.
And what does a medical examiner or pathologist do?
A forensic pathologist determines the cause and manner of death in cases of sudden unexpected death or in cases where death is presumed to be due to homicidal, suicidal, or accidental means. So in any case where death is expected to be non-natural, we determine the cause and manner of death. We do that through various medical examinations, primary of which is the autopsy examination.
And you are licensed to practice medicine in North Carolina?
I am.
When did you become licensed to practice here?
In 2012.
And if you could tell the jury where and when you received your medical training?
Yes, I went to the University at Buffalo for medical school, receiving my MD degree in 2008. I then did 4 years of anatomic and clinical pathology residency at Dartmouth in New Hampshire, finishing that in 2012. I did my final year of training, a fellowship program in forensic pathology at the Office of the Chief Medical Examiner in Raleigh, and completed that in June of 2013.
And have you testified before as an expert in forensic pathology?
I have.
How many times have you testified?
I believe it's 13 times now.
And where have you testified? In what venues?
In the state of North Carolina courts.
And has it always been in superior courts?
Yes.
Your Honor, at this time I would tender as an expert in forensic pathology, Dr. Lauren Scott.
Okay. Services.
You talked a little bit about some of what you do as a pathologist or an ME. Can you, do you have any specific duties, or if you could describe day to day what it is that your job involves?
Yes, so primarily we perform autopsy examinations to determine cause and manner of death. Do you want me to go over what an autopsy examination entails?
If you would.
Sure. So the first step in an autopsy examination is to do an external exam of the decedent, noting any clothing, personal effects that they come in with, noting any identifying marks on their body surface, and any evidence of injury on the external body surfaces, also noting physical characteristics such as length and weight. We document everything throughout the autopsy, both in writing and through photographs. Once the external examination part is complete, we then proceed to an internal examination of the body cavities, making incisions into the chest cavity, into the abdominal cavity, and into the head, exposing all the organs and body cavities, noting any traumatic injuries that are present within the body cavities, and any evidence of natural disease. All of the internal organs are then removed and examined further, again along the process noting any evidence of traumatic injuries or of natural disease. In certain cases, small pieces of the organs are taken and looked at under the microscope to further document disease processes. In other cases, body fluids and certain organs are saved for toxicology testing. When all of our ancillary tests, such as toxicology and microscopic slides, are complete, we then compile a written autopsy report documenting all of our findings and expressing our opinion as to the cause of death.
Now, are autopsies done in every case in which someone dies in North Carolina?
No, the autopsies that we do at the medical examiner's office are for cases where someone is suspecting that it might be a non-natural death, so that death is due to an accident, a homicide, or a suicide.
And who makes the determination as to whether an autopsy should be done or not?
It's a collaboration between the medical examiners and investigators such as law enforcement or Bureau of Investigation agents that are at the scenes.
And during the course of both your education as well as your experience working as a medical examiner, how many autopsies approximately have you performed?
About 900 now.
Did you perform an autopsy on Jose Perez? And if you did, on what date did you do that?
I did perform an autopsy on Jose Perez, and that was on June 17th of 2013. And
where was that autopsy performed?
At the Office of the Chief Medical Examiner in Raleigh.
Where is that?
It's at 4312 District Drive.
Did you do an external examination of Mr. Perez's body?
I did.
Can you explain or tell the jury what it is you found when you did the external examination and what your diagnoses were from that external examination?
Yes, there were several injuries apparent on the external examination, most of which were sharp force injuries, which are injuries made with some instrument that has a sharp or cutting edge. I'll refer to my diagram so I don't leave anything out. There was one sharp force injury along the left cheek to left jaw line, and this was an incised wound, which means that it was longer on the skin surface than it is deep into the body. And this sharp force injury along the left cheek fractured the lower jawbone or the mandible, and also fractured the dentures that the decedent was wearing. There was another perforating injury on the left cheek that went through the left cheek and into the oral cavity. There was another incised wound, which again is a sharp force injury that is long along the skin surface, along the right side of the cheek to right jawbone. And this sharp force injury was a stab wound which went deep into the neck and severed the carotid artery, which is the main artery carrying blood to the head from the heart on the right-hand side. There were two smaller stab wounds on the right cheek as well that just superficially penetrated underneath the skin surface and did not cause any major injuries. There was a stab wound just above the left collarbone on the front of the left shoulder, and that wound went down to the left collarbone, causing a small indentation on the left collarbone. There was also a stab wound on the left chest, which went into the chest cavity and perforated the heart, causing bleeding into the chest cavities. There were several sharp force injuries, mostly stab wounds, on the back. There's a total of 5 sharp force injuries on the back, one of which was on the right lower back and penetrated into some of the fatty tissue that surrounds the kidney, but didn't actually penetrate the kidney itself. There was a very superficial stab wound on the left back, which did not cause any major injuries. There were 3 stab wounds on the mid to right upper back. 2 of these entered the chest cavity. One of them did not cause any injuries to any organs. The other penetrated the right lung, again causing some bleeding into the chest cavity. The third one did not enter the chest cavity at all and just penetrated the musculature of the back. There was also a stab wound on the front of the left arm. There were 2 small sharp force injuries on the front of the left wrist. These were very superficial cutting injuries. There was an injury on the front of the right wrist, which may have been inflicted after death because there was very little hemorrhage around it. And the characteristics of this injury on the right wrist weren't very clear. It could have been either a sharp force injury or a blunt force injury. And there were also several bruises. There was a bruise on the back of the left hand, on the back of the left forearm, at the base of the left thumb, and there was an additional superficial cutting injury on the back of the right hand. And those were all of the major sharp force and bruises that were on the body. One additional injury that I saw was on the very back of the midline neck. There was an abrasion, which is a blunt force injury made by an object without a sharp cutting edge, rubbing up against the skin surface and wearing away at the outer layer of the skin surface. This abrasion on the back of the neck had an appearance that it could have been from a gunshot wound very superficially grazing the skin surface, but it wasn't entirely characteristic for that, so I can't rule out that it wasn't through some other blunt force object rubbing up against the back of the neck. And those were all of the major injuries that I saw in external exam.
Did you, during the course of your examination of Mr. Perez, take photographs of the injuries that you observed?
Yes.
May I approach?
Yes, ma'am. Notice and receipt. Right, to reflect, here's actually the courtroom. The court reserved ruling on record on photographs, all types of photographs until this time from our pre-trial hearing. The state intends to, or has offered, or intends to offer, state exhibit number 35, which contains 39 photographs. I believe that's correct.
It's 25 photographs.
25 photographs, but the ones that the defendant objects to is 37, 38, and 39
Yes, Your Honor.
among the photographs. And I would be glad to have the state present these to good doctor, and we'll see what she says about him to determine whether or not they come into evidence in this case. Is that correct?
That is correct, Your Honor.
Thanks, sir.
Photograph 37 shows the indentation on the left collarbone from the stab wound of the right shoulder. It depends if you feel the need to see an internal injury. We do see the evidence of the stab wound on the external surface of the body.
So what you see on the exterior of the body is the stab wound, and the
Yes, and what's
number
in
37 JPEG is the
actual
the
indent.
internal injury
Yes.
that stab wound caused.
Yes.
And what about JPEG number 38?
38 is a close-up of the left collarbone with the injury on the surface of the left collarbone.
And can you point out to the judge where that injury is so he can
Yes.
be clear about what he's looking at?
This is the collarbone running here, and this is the indentation on the collarbone. This is the skin of the left chest pulled back to expose the musculature in the collarbone. And 38 is a close-up of this region. So showing the collarbone and the indentation on the collarbone. Probably not both pictures would be needed, but if you did want to display the internal injury that corresponds to the external stab wound, you'd need at least one of them. Neither of these actually cause significant bleeding that would impact the cause of death, but it does speak to what type of instrument was making these wounds.
And the indentation that you're talking about on the collarbone you referred to that as a partial fracture?
Yes.
And then JPEG number 39, what does that show?
.39 is a close-up of the fractured left lower jawbone or mandible. So this is the fractured edge of the mandible. It should connect up to the rest of the mandible and no longer does because there is a complete fracture of the bone.
That's Sean State.
It is.
You want to ask me a question?
Just briefly, Your Honor. Dr. Scott, excuse me, we haven't got started with you. So 37 and 38 are the same injury, correct?
Yes.
And you said you probably wouldn't need both of those to show the inside, inside damage caused by that wound.
Right, one of those could certainly be eliminated.
And in 37 and 38, you do have a picture of the external wound on that, correct?
Yes.
And which picture is that?
Let me look through the pictures.
It's 21 and 22, I
That is
believe.
in, yes, 21 is the further away picture of it, and 22 is the close-up picture.
So you have two pictures of the outside of that wound, correct?
Yes.
And from those pictures of the outside of the wound, you could tell yourself that it was a sharp force injury, correct?
Yes.
And it was an incision type of wound that ended up breaking, you said the clavicle?
Yes.
And so 37 and 38 are just to show the broken clavicle,
Yes.
but you can talk about that without displaying any of those pictures.
I could.
And 38 just show additional musculature side muscles of Mr. Perez injured in any way by this injury that you could show from the outside, correct?
Right. They primarily are featuring the partial fracture of the collarbone or clavicle.
And you were able to, I guess you will be able to discuss that with the jury fully, without showing those pictures.
It would be helpful to have an internal picture, but I could certainly discuss it without the picture.
And the broken clavicle wouldn't have been fatal to Mr. Perez.
No.
And dealing with 39, 39 is a close-up of the lower jawbone.
Yes.
And that inside picture correlates to what outside? Which outside picture?
To 19 and 20.
So you
Nine-
have,
19 being the further away image of it and 20 being the close-up image of it.
so you have two pictures of the outside of that wound.
Yes.
But there is actual additional damage in 39. I think that's a little bit different in 37 and 38, correct?
It's similar. 39 and 37 and 38 are all showing internal injuries rather than external injuries.
And I guess I mean to say that maybe 39 is more, I guess, more significant to you in order to show the trauma that was occurred, but you don't necessarily need it in order to talk about this injury.
39 was more significant trauma than 37 and 38.
No further questions, Your Honor.
Any further statement?
All of the photos would be helpful in your testimony about the injuries to Mr. Perez, wouldn't they?
Yes.
But not necessarily you could do it without it, could you, Doctor?
They'd be helpful, but I could do it without it.
And you have other pictures to show the outside injuries, correct?
Yes.
And in relation to the other stack of pictures, even not being an expert, those are easily the most graphic pictures in your stack, correct?
Depends on what your definition of graphic is.
I mean, you probably have a different definition, but for, I guess, lay people that don't do this on a day-to-day basis, those would be the most graphic or grotesque pictures in that stack.
Again, it depends on what your definition of graphic is.
No further questions, Your Honor.
Yes, I do.
Your Honor, I think she can talk about 30. I think 37 and 38 are different than 39, but I think 37 and 38 are just showing the musculature, the insides, shoulder area of Mr. Perez. It was not a fatal injury. She will be able to talk about the injury that was sustained to the outside of Mr. Perez and the stab wound sustained by him without, peeling his chest back and displaying that to the jury. I think showing these pictures to the jury would be overly prejudicial. We're already dealing with photos that we haven't talked about at this point, but I think obviously there are wounds that she already talked about that will be bad enough on their own, and I think this is just, I guess, adding to the grotesque and excessive nature of these photos by adding them, but I think they're the only photos that show the wounds that he sustained, so I don't think we have a position to keep those out, but obviously on these ones where they're duplicative and excessive, and we have them from the outside, and she will be able to fully talk about the injuries that they sustained. I would ask that we keep 37, 38, and 39 away from the jury. I don't think it would be a violation of Ms. Madonna's rights to a fair trial if these are shown to the jury.
Now, since that,
Your Honor, the jury is entitled to see the damage that was done by the defendant so long as the information that's shown is not excessive or unduly prejudicial. There are only 25 photographs taken by the ME's office and transmitted to us. These are all the photographs that were taken. As the ME has already testified, she's responsible and in fact did both an internal and external exam. These photographs illustrate both internally and externally what she found, at least to some extent. And I think one of the things that the pictures that offend the defendant would show is that there was a fair amount of force used in the injuries that were made on Mr. Perez's body, and I think that is something that the jury ought to be able to consider, and part of that degree of force is shown by the internal fracture of bones from a stab wound.
record replayed the court had reviewed, the pictures 37, 38, 39, was testified to by the doctor. I'm going to sustain, you get to choose 37 or 38, both of them don't need to come in. I'll sustain that objection, objection to 39 is overruled. So you need to amend your,
I'll remove 38.
38 is removed. And so we'll have 24 pictures other than 25.
Get out of there.
You think from the record of the time?
No, Your Honor.
You may bring it through. Time during the trial of this particular case that you were excused from this courtroom while we took up the matter in your absence. We excused you from this courtroom because we did not want you to know what we were doing. We had wanted you to know what we were doing. If we did anything at all, we'd let you stay in here. In fact, we may have done something, if anything at all, is not important to you, and you should place no importance upon it at all. If you want to know what we did, if anything at all, when you were not here, and you ask me after this trial is over, and if I remember, I'll tell you. But otherwise, don't worry about it at all. Witness for the state.
Thank you, Your Honor. Dr. Scott, after you did your external examination of Mr. Perez's body and noted all of the injuries that you've told us about, did you do anything further?
Yes, I did an internal examination, and I alluded to some of those findings already.
And how do you do the internal examination? You actually, you said remove some of the organs and test those, is that correct?
First, incisions are made into the chest cavity and into the abdominal cavity, and the organs are observed as they sit within the body cavities. Notes are made about any unusual fluid collections, such as collections of blood in the body cavities, and any wound tracks, such as stab wounds, gunshot wounds, are noted as the organs sit in the body cavities. The organs are then removed to further examine the organs for any evidence of injury that could not be seen when they were still within the body cavities, and for any evidence of natural disease.
And when you say that you look at where the wound track is or the direction of the wound track, why do you do that? What can that tell you?
It can, it gives a determination of whether the wound track was going upward, downward, left, right, front, or back through the body organs and body tissues.
And as part of the autopsy, do you do anything further than an internal investigation and an external observation of the body?
Yes, for most autopsies, microscopic slides are made of the major organs and examined under the microscope to look at for any evidence of natural disease primarily. Also, certain body fluids and organs are collected and sent to the toxicology lab for testing for alcohol and in certain cases for other drugs.
And did you send any body fluids from Mr. Perez to the toxicology lab for testing?
Yes.
And what kind of body fluid did you send?
I sent several, but the one that they tested was blood from the aorta or the major artery leaving the heart.
Is there some reason why blood from the aorta would be tested over blood from anywhere else in the body?
It's an easily accessible area that yields a lot of blood.
And did you get a result from the tox lab about whether there were any substances in Mr. Perez's bloodstream at the time of his death?
There was only alcohol tested for in this case, no other drugs, and there was no alcohol or ethanol detected.
And what's ethanol?
It's standard drinking alcohol, such as in beers and wines.
And alcohol is something that's metabolized by the body over time, is that correct?
Yes.
And so depending on how much alcohol you've consumed, what your body size is and weight, and how long you survive after consuming alcohol, can you say with any kind of medical certainty whether or not Mr. Perez had consumed alcohol within the last 24 hours prior to his death?
Last 24 hours I wouldn't be able to say. Likely within the last few hours he hadn't consumed any alcohol.
And alcohol, since it's something that's metabolized out of the body, once someone has died, that metabolism stops, correct?
Yes.
And so the amount of alcohol after death would remain relatively stable for the purposes of you testing after the death of someone.
Yes.
Now, did you, during the course of your examination of Mr. Perez, one of the things that you mentioned was the sharp force injury to his jaw, which cut his mandible, his lower jawbone, completely through. Is that correct?
Yes.
And can you quantify in any way the amount of force that would have taken to transect someone's lower jawbone?
It depends on the specific type of instrument that was used, but generally it would take a fair amount of force to transect a lower jawbone. It's one of the strongest bones in the body.
Now, we were talking earlier about photographs that you had taken during the course of the autopsy, is that correct?
Yes.
And you have in front of you what I believe has been marked as State's Exhibit number 53.
Yes.
And that, what is that?
This is copies of the photographs taken during the autopsy of Jose Perez.
And have any of, you've looked at all of the photographs, is that correct?
Let me make sure I've looked at all of them. Yes.
And do they all appear to be as you took them at the time that you did Mr. Perez's, or as when they were taken when you were doing Mr. Perez's autopsy?
They do.
None of them have been altered.
No.
And would the use of these photographs help you to clarify and explain to the jury the various injuries that he sustained?
Yes.
Your Honor, at this time I would offer into evidence State's Exhibit 53.
You got
No objection to South Line passing.
motion to introduce the evidence, allowed.
If we could look at this first one.
Oh,
Yes,
doctor may stand now.
okay. Okay. Now, Dr. Scott, this is JPEG number 15 from the autopsy of Mr. Perez in State's Exhibit number 53. And can you tell us what that shows?
Yes, this is a close-up of the decedent's face. In every autopsy, we take an identification photo, which is basically a close-up
Just
of
go to the
the
next
face
one.
of the decedent. And at the bottom part of the picture is the unique identifying case number associated with this particular decedent.
And what does this photograph show?
This photograph shows the identification photograph with the close-up of the face. You can just barely see an injury on the left cheek region.
And is that one of the sharp force injuries that you described earlier?
It is.
And if we could look at JPEG number 16. I know. That's it. Can you tell us what JPEG number 16 in State's Exhibit number 53 is?
Yes, this is a close-up of the left cheek of the decedent. This is the corner of the left mouth here. And this is a sharp force injury of the left cheek, which entered the left cheek and the oral cavity.
Now, there are a lot of sort of red spots all over Mr. Perez's face in this photograph. Can you tell me what those are?
Yes, these red spots are consistent with post-mortem insect bites.
And how long does it usually take before something like that happens?
It depends on where the decedent is located, but it can happen fairly quickly after death, within minutes.
If you'd scroll to 17, please. Keep going. Oh, back. This is JPEG number 17 in State's Exhibit number 53. Could you tell us what that is?
Yes, this is a close-up of the top part of the left arm. So in kind of the same plane that my arm is in right now. And this is a stab wound of the left arm. This is the stab wound itself here, and surrounding it is an area of contusion or bruising.
And of the photographs that we've seen so far in State's Exhibit number 53, none of these injuries so far would have been fatal injuries. Is that correct?
And that's correct.
And go to 18. What does 18 illustrate?
18 is a close-up of that same stab wound on the underside of the left arm.
It looks sort of round, not like some of the other stab wounds that are on Mr. Perez's body. How did you determine that this is a sharp force injury and not a blunt force injury?
I could see the track of the wound through the skin surfaces, through the muscle and the soft tissue in the arm. I could also see the edge of the wound doesn't appear to be ragged.
And a ragged wound is what would happen if it was a blunt force injury.
Yes.
And a gunshot wound would be a blunt force injury, is that correct?
A gunshot wound is partly a blunt force injury and partly either a perforating or penetrating injury. And this injury did not go as far as through the body as I would expect a gunshot wound to travel.
And
It only went to the muscle, it didn't actually exit the arm.
if we could look at JPEG 19.
This is the cutting injury on the left jawline of the decedent. So this is the bottom part of the decedent's left ear here. And this is a long cutting injury. This is the injury that went into the jawbone of the decedent and actually fractured the jawbone in half.
When you received Mr. Perez's body, did he have dentures in his mouth as well?
He did.
And were the dentures intact in his mouth when you received his body?
No, the dentures were also broken secondary to the force of this injury.
And what is it that we're actually looking at here? What structure inside the skin, inside of his oral cavity are we seeing?
In this picture, all that's evident is some muscle and soft tissue underlying the skin.
If we could go to the next one.
This is a close-up of that same injury on the left jawline.
And this is JPEG number 20, correct?
I don't know if I have a number on mine.
On your paper?
I'd have to grab the other paper. Yes, that's number 20.
So when we're looking at this wound a little bit more closely, there are, I'm not sure exactly how to describe it, but there are things of different color that we're looking at. Can you tell us what for instance, the light pink is that we're looking at and the darker areas as well?
This light pink on the top of the skin is an area of abrasion or something rubbing away at the outer layer of the skin. So whatever instrument made this likely dragged slightly across the skin surface. This black discoloration happened after death. It's drying of the skin surface around the wound edge.
And in the middle of the wound, is that jawbone that we're looking at or what?
Don't know that I can say from this picture. There is another picture which will more clearly show the jawbone.
Okay. Now, surrounding the major wound in this photograph, there are areas of small areas that are red and have some kind of red fluid on them. What are those?
Again, those were consistent with insect bites that occurred, likely after death.
And looking at State's Exhibit 53, JPEG number 21, what are we looking at here?
This is the top of the decedent's left shoulder, and this would be the decedent's left arm extending out this way. This is the decedent's neck here. This is a stab wound of the top of the left shoulder. And this is the stab wound that went down to the left collarbone and left a indentation or partial fracture of the left collarbone.
'22, please. What is JPEG number 22 from State's Exhibit 53?
Number 22 is a close-up of the stab wound on the top of the left shoulder.
And 23?
'23 is the left chest region of the decedent. So the head would be up there, the feet down that way, left and right. You can see the bottom part of the decedent's chin there. This reddish area here is the actual stab wound. The discoloration of the skin you see here is drying of the skin after death. And this is the stab wound that entered the left chest and ended up perforating the heart and causing bleeding into the chest cavities.
And were there associated injuries with the stab wound, aside from the penetration of the heart?
The associated injuries would be massive bleeding into the chest cavities.
How much blood does a person generally have in their body?
It depends on their exact height and weight. Generally, an adult will have about 6 to 7 liters of blood.
And when you examined Mr. Perez's body, how much blood did he have left in him?
I can't quantitate how much blood he had left in him, since that would require draining all the blood out of his vessels. But I can tell you that in his chest cavities, he had about 500 milliliters of blood in the left chest cavity, 700 milliliters in the right chest cavity.
And in terms that normal people use, we don't use milliliters very often. Can you tell the jurors about how much that would be in ounces or pints or quarts?
You know how much a liter container is of, say, Pepsi? 500 would be half of that, 700 would be about 3/4 of that.
And what kind of, you said that this would cause massive bleeding into the chest cavity?
Yes.
Since it penetrated the left ventricle of the heart, aside from the bleeding, what would it have done to the heart itself?
Blood would have also surrounded the heart, preventing it from pumping effectively.
And that this wound in and of itself, would it be fair to say, would have been a fatal wound?
Yes.
Now, there's some discoloration all around you can see on Mr. Perez's chest. Can you tell us what that is?
These more reddish areas on the chest are areas where the blood is settling after death due to the effects of gravity. So likely this portion of his body was face down at some point after he died, allowing blood to move through the effects of gravity and settle there. So it's a after death change.
And could we look at JPEG number 24 and states 53?
JPEG 24 is a close-up of the stab wound on the left chest.
And how far did the stab wound, this stab wound, what would the track of it go into the chest?
Find that in the report. Had a total depth of about 2.5 inches.
And what was the direction of the wound, the track of the wound?
It was from the decedent's right to left, from the front to back, and downward.
Does that, are you able to make any kind of assessment with any kind of certainty as to the position that the victim was in relation to the person stabbing him from the wound track?
No, because it depends on specifically where both the person stabbing the decedent and the decedent were located, exactly how their bodies were twisted and what position they were in. All I can say is that that's the direction it was through the body, assuming someone was standing like this, which someone is not going to be standing like this when they're being stabbed.
And let's look at JPEG number 25.
This is a close-up of the decedent's right cheek, and it shows 3 different injuries. These right below the right ear are 2 very superficial stab wounds that just went into the musculature of the cheek and did not cause any major damage. This is a large incised wound or sharp force injury that is longer on the skin surface than it is deep into the body surface. And this ended up penetrating down into the neck and perforating the carotid artery of the right neck, which is the main artery on the right side of the neck, bringing blood to the head.
And what would have been the immediate result of this slashing or stabbing wound?
That would have also caused massive bleeding and could be a fatal wound.
in and of itself?
Yes.
And JPEG number 26 in State's Exhibit 53.
This is a close-up of the wound along the right jawline, which ended up perforating the carotid artery.
Now, it went through the muscles of his neck?
Yes.
And once those muscles were cut, would he have been able to control his head in any way?
He still could, since the nerve itself wasn't severed, and not all the muscles of the neck were severed.
And there are some sort of small white things around the wound. What are those?
Those are maggots.
In State's Exhibit 53, JPEG number 27, what are we looking at?
This is a close-up of the two sharp force injuries just below the right ear. So here's the edge of the right ear. And these are both superficial injuries that did not cause any significant damage.
And what were the wound tracks of these injuries?
These are both from the right to left and downward, and did not deviate significantly front or back.
So they were
So
pretty
angled
much
slightly downward and kind of straight in to the side of the cheek.
straight on from the side.
Yes.
And State's Exhibit 53, JPEG number 28, what is that?
This is a close-up of the back of the decedent's right hand, showing a small cutting injury on this part of the hand.
There's some bruising as well, is that correct?
Yes, a bit hard to see in this photograph, but there's some bruising at the edge of that sharp force injury, and also a separate area of bruising at the base of the thumb.
And can you tell from the appearance of that bruising whether it appeared to be new bruising or old bruising?
It's new bruising.
And there are other sort of red areas on the back of Mr. Perez's hand. What are those?
I believe you're referring to these, which are again some insect bites that happened after the time of death.
And looking at State's Exhibit 53, JPEG number 29, what are we seeing here?
This is a close-up of the left hand. Make sure I have that right. Now that's of the front of the right wrist. And this is the injury that I described before that didn't have a lot of hemorrhage around it, so could have happened after death.
And there's
And has characteristics of both a blunt and sharp force injury. I couldn't tell for sure whether it was due to some blunt object rubbing up against the skin surface or something cutting the skin surface.
it was not a gunshot wound to the wrist, was it?
No.
You would have found a projectile within, or you would have found an exit wound on the other side, correct?
If it was a grazed gunshot wound, then I wouldn't have found a projectile inside the body or an exit wound, but it's not consistent with a grazed gunshot wound.
If you could scroll up a little bit to, down, sorry. Near the, below the inch marker that you've got on Mr. Perez's hand, to the bottom left, there's another marking. What is that?
I'm not sure which marking you're referring to. Some stray plant matter that's on the hand surface.
And now looking at State's Exhibit 53, JPEG number 30.
This is an overall photograph of the sharp force injuries on the decedent's back. So this would be the left side of the decedent, right side of the decedent. And in the view right now is 4 of the sharp force injuries. Down lower is the 5th one.
And there are some sort of round indentations on Mr. Perez's back. What are those?
Those are pressure marks from him lying against our autopsy table.
And can you go through, starting with the top injury on his back, and explain each of those injuries just briefly?
Yes. We'll start with these 2 injuries. I'll refer to my report to make sure I don't mix them up.
You gave each of the injuries a letter, didn't you?
Yes.
Okay. So if we're looking at the top injury on Mr. Perez's back, what did you call that?
This injury here I called injury N. And this injury was a stab wound that entered the right chest cavity. I believe, yes, entered the right chest cavity and did not actually injure any of the organs within the chest cavity.
What was the wound track?
The wound track of this was back to front, slightly right to left, and downward. So in that direction.
And the next one?
And this is another stab wound.
And what did it?
This did not enter the chest cavity, it just penetrated the musculature of the right back. And its direction was from back to front, from left to right and upward. So in the almost opposite direction of the previous wound.
And the other 3 wounds on his back?
This was a very superficial sharp force injury of the back, only entered the subcutaneous tissue, the tissue directly underneath the skin surface, and did not cause any major injuries. This was a stab wound which entered the right chest cavity and perforated the right lung, which again would cause some bleeding into the right chest cavity.
If untreated, would that have likely resulted eventually in Mr. Perez's death?
If untreated, it likely would have, yes.
And what would have been the mechanism by which that would have killed him?
Hemorrhage from vessels within the lung itself into the chest cavity.
And the next?
And this final injury was on the right lower back, and it went through the musculature of the back, entering the abdominal cavity, and went through some of the fatty tissue surrounding the kidney, but didn't actually puncture the kidney itself.
And so of the 5 wounds seen on Mr. Perez's back in this State's Exhibit 53, JPEG number 30, one of these injuries would, if untreated, have eventually led to his death.
Yes.
And let's look at JPEG number 31 in State's Exhibit 53. What are we looking at here?
This is a close-up of the wound on the right lower back, which penetrated the fatty tissue surrounding the right kidney.
And 32.
These are close-ups of 2 of the sharp force injuries on the right back. This was the one that was very superficial. This is the one that entered the right lung.
And JPEG number 33. Next.
And these are the final 2 sharp force injuries further up on the right back.
And JPEG number 34, what is that?
This is the back of the decedent's neck and head. So this is his neck here, and his head up here. This is the abrasive injury that I spoke of before. An abrasion being a blunt force injury that wears away the outer surface of the skin. And this injury to me could possibly be a grazed gunshot wound. It has the kind of classic appearance of a grazed gunshot wound, but I can't completely rule out that it wasn't just some other object rubbing against the back of the neck.
And 35.
This is a close-up of the abrasion on the back of the neck, which may or may not be a grazed gunshot wound or some other blunt force injury.
You can't take out the next one, can you? Okay, thank you. All of the photographs that the jury has seen so far were from external examination of Mr. Perez's body. Is that correct?
Yes.
You did some internal investigation of some of the wounds that we've seen photographs of, the external part of it.
Yes, there are a few internal pictures taken.
And you have in front of you States Exhibit 53, JPEG number 37 and 39. Is that correct?
Yes.
May I approach?
Yes, ma'am.
Your Honor, because of the nature of the disc that we have, there was, we're unable to scroll to these two last photographs, and I would ask the jury be allowed to look at them by passing them.
That's fine. She can talk about them and move down one to the other. I think that would probably be better.
Okay. If you want to step down and just show States Exhibit 53, JPEG number 37, and tell us what that is.
JPEG 37 shows the skin of the left shoulder and chest region reflected back. So we have made an incision into the left chest region. Sorry. We have made an incision into the left chest region, and the skin is reflected back, and this shows the left collarbone running here. The decedent's left ear is up here, head is up here, so this is focusing on the left shoulder. And within the left collarbone, there is a defect produced by the instrument which created the stab wound that started on the top of the left shoulder and then went down to the left collarbone.
And when you talk about a defect, what are you talking about?
It's actually a little indentation in the bone, which we can call a partial fracture of the collarbone or clavicle.
If you want to maybe just start at one end so that everybody, and then walk to the other so everybody can see it.
The collarbone here and defect within the collarbone. Collarbone running here and the defect within the collarbone.
And if you could turn now to JPEG 39 within States Exhibit 53 and show that to the jury and explain so they can understand.
Yes. So this is a portion of the decedent's lip being the jawbone.
The glare is really bad.
So this is the decedent's lip being pulled back to reveal the jawbone, and you can see an end of the jawbone sticking out right here. It has been cleanly cut through, and the end of the jawbone does not connect up to the rest of the jawbone as it should, but is completely fractured.
Okay.
That's the end of the jawbone right there. The cut end of the jawbone right here.
Thank you, Dr. Scott. Now, you talked earlier about, and we saw the photograph of the sharp force injury into the arm of Mr. Perez that went through the muscle. That also penetrated one of the veins in his arm, didn't it?
Yes, the brachial vein, which is one of the main veins in the arm.
And that wound, would that have been fatal had it been left untreated?
It's difficult to say with that wound since it was a vein rather than an artery. It tends to bleed a bit slower. If there was really absolutely no medical intervention, then it probably would have ultimately been fatal, but it's difficult to say for sure.
And in the wound that fractured Mr. Perez's jawbone and dentures, was his tongue also cut?
Yes, yes, there was also injury to the left side of the tongue.
When you received Mr. Perez's body, it wasn't in exactly the same shape that we saw the photographs. Is that correct? I mean, you clean the body, wash the body at some point before examining it, don't you?
Yes, before the photographs were taken, any blood or most of the dirt on the outside of the body surface is washed away.
Why do you do that?
To be able to see the actual wounds clearer.
Now, there were some wounds that you talked about on Mr. Perez's, the backs of his hands as well as on his wrists. Have you ever heard the term defensive wounds?
Yes.
And what do you understand that to be?
Some people call injuries on wrists and hands and on forearms defensive type wounds because they can be received when someone is trying to block an object from hitting their chest or abdomen. However, the wounds can be received in other ways other than defense.
Are the wounds that you've described and that the jury has seen on the fronts and backs of Mr. Perez's hands and wrists consistent with what you understand a defensive wound to be?
They're defensive type wounds.
When you did your internal examination of Mr. Perez, were you able to determine whether or not there was any evidence of health issues or disease as part of your autopsy?
There was evidence of natural disease.
What kind of natural disease did you see?
There was coronary artery disease or narrowing of the coronary arteries. He'd actually had a stent placed in one of his coronary arteries to try and open the area and prevent it from narrowing. He also had a slightly enlarged heart. Normal heart's usually about 400 grams. His was about 450. And one of the chambers, the left ventricle of the heart, was slightly thickened. Those changes of the enlarged heart and the enlarged left ventricle chamber of the heart are consistent with high blood pressure, hypertension. He also had some evidence of lung disease, a stone in one of his kidneys, and an enlarged prostate.
And
You gonna be much longer?
not terribly much.
You don't have any questions?
All that, but,
Okay. Ladies and gentlemen, we're going to take our luncheon recess at this point. During our luncheon recess period, it is your duty not to talk among yourselves about this case. You do not to talk to the parties, the witnesses, or the lawyers about anything at all. Further duty not to talk to anyone else, allow anyone else to talk with you, to say anything in your presence about this case. Avoid reading Watkins County accounts of this trial if there are any. Do an individual investigation of your own. Stay away from your smartphone. And do not form or express the opinion about this case during this time. With that, while everyone else will remain seated, I'm going to excuse the 13 of you and ask that you return and assemble in the jury room at, we'll say 2:15 this afternoon. That's your excuse.